The heart of this question doesn't really come from the protein question. It comes from this word psoriasis. So I don't know why I get so many psoriasis questions, but he says, so he hasn't started the ketogenic diet. He does CrossFit. He has an area of cirrhosis. Usually that's a skin proliferating process. So earlier I talked about what makes uric acid high and those inflammatory processes that are cell proliferating. So he's making extra cells. And psoriasis it's a reflection of your immune system going a bit wacko. It's also a predictor of high insulin. So he was wondering if he should start the ketogenic diet, and especially if he's got an outward sign of an inflammatory problem. This is actually another autoimmune problem, so I kind of use those words interchangeably when I'm talking about autoimmune problems. One autoimmune problem that's very common is rheumatoid arthritis, where the body attacks the joint spaces. Another autoimmune problem is lupus, where it attacks blood vessels. If your immune system attacks your thyroid, it can be thyroiditis. If your immune system attacks your gut, it can be Crohn's disease, ulcerative colitis. But those are really hidden deep inside your body. One thing about having an autoimmune problem of the skin is people come in and they tell me about it. Like, doc, I can't get this patch to go away off my elbow, behind my knees, on my ankles. I have this strange skin thing. This picture of it is a great example where you can see that you can see that one spot where he's picking off some skin cells that won't slough off. And you can see there's a really big red patch there that is where his psoriasis is really in a flare. So shoulders are one place, the elbows, the knees, the ankles, all tend to be places where this autoimmune problem, again, autoimmune means your immune system is not attacking the enemies, the invaders, it's attacking you. It's attacking your own thyroid, your own joints, your own gut, your own blood vessels, and in this case, your own skin. So for psoriasis, let's dial in a little bit further and you can see how cracked those skin cells are. They are not fitting together very nicely. This is what happens inside the joints and the gut and the other places in the body when your immune system gets attacked. But psoriasis is, again, something patients really show me. So immunity and your immune response is what we're talking about here. I've done a few other shows about that. Here are these little plasma cells, which is where the error is coming from. Your body is supposed to be protected by this. And unfortunately, the cracks in his skin are so thick, are so large, that these little bugs are actually getting in there. So now you have infection flaring. You have more of these plasma cells saying, hey, we got a problem. Something's going wrong here. We definitely need to be helping defend against this. But those white blood cells get confused and then they start to attack the skin cells even more. The psoriasis gets worse. And you say, well, what should we do about that? How would you fix that? I like to point out these other little cartoons where I have this huge inflammation coming out of the flames coming out of that insulin is because that insulin is it is a flare. It is on fire because it's in excess, which is very commonly associated with autoimmune problems. You'll find that their glucoses aren't always high, or the glucose will be in normal range for a long period of time for uric acid. Had he been looking at his Dr. Boz ratio for the last 30 years, maybe not every day, but a few times a week, he would have seen that his insulin is very high. His Dr. Boz ratio is very high. And that is what is associated with some of these chronic inflammatory problems. So this gentleman wants to know, can I get better? I've read things like psoriasis is cured by the ketogenic diet. And I'm a little careful to overpromise, but I do like to provide hope. And that is when you look at those skin cells, and if we look at just dial in and look at how beautiful the skin looks in a different area of that man's arm. Those skin cells are perfectly fit together. They've replicated in a way where those skin cells definitely have the supply of fat that makes a prettier skin cell. So it sounds a little vain. I'm not trying to do that. I'm trying to truly represent that if you are looking at a skin disease or a skin disorder where they don't fit together well, and you're saying, well, the ketogenic diet helped that. The close dial-in to showing you the flaky and defective skin as compared to healthy skin, it starts with, was there enough fat around for you to make healthy skin cells? It also is, once you start to make healthy skin cells, you replicate the healthy ones. The man in the picture and the man in the who wrote the question in, he is replicating defective cells. Those cells aren't beautiful. They are lacking in fat. They are just skimping and trying to reproduce in a way or replicate in a way that it isn't ideal, but it's the best those skin cells can do with the resources present. And boy, oh boy, those skin disorders can last for a lifetime. They can't get them to go away. The treatments that we have for improving that include a steroid. We rub the steroid on the skin, try to get the inflammation out of the skin. We then give their immune system some modulators so that the immune system kind of stops attacking it. But boy, that's still a serious defect in the approach to a better response of how do you get it to go away. When we look at the improvements for gut health, for thyroid, for this autoimmune problems like psoriasis, a psoriasis diet is high in fat, low in carbs, and has a Dr. Boz ratio of at least under 100. I love my autoimmune patients to reach for a Dr. Boz ratio of 40 several times a week if they're really trying to repair an immune system that's kind of gone wacky. It's attacking the person. Again, I have lots of prescriptions that I could prescribe to help, but they're short term. They're just going to take care of the problem for a little while, and then we hope that the body kind of resets during that time. But if we don't teach the patient about how to eat a better diet, a high-fat, low-sugar, low glycemic index, I love it when carbs are less than 20 because it's really hard to screw up when you get them that low. But if life has a season and you're not able to handle that, then you do the best you can with where you're at. So for my patients with psoriasis, I have sent all of them to say, if you really want to see how to do the ketogenic diet in a way that could improve your health, that it can improve that psoriasis, maybe cure it, which comes with a whole host of steadily improving it, I send them to the link in the show notes that has to do with the course that is online. It is the content that the book I'm writing is going to promote. Right now, the only way you can get the content is through that online course, and it is a very methodical, structured way to get through how do I get my patients on a ketogenic diet and stay there. The course is called Consistently Keto, and it's because that immune problem, just like the uric acid problem, it's not going to go away in a week or two. It's not even going to go away in 3 months. It's going to take us a few years of repairing that body, really the internal health of their mitochondria and their immune systems. That has to improve in order for these things to go away. He's been promised, the uric acid guy has been promised that his uric acid will get better on a ketogenic diet. But the time it takes to do that is only if his insulin is going down. Immune system problems where you see these amazing stories of improved health, they are not guaranteed if the insulin didn't go down. And that's why we check a ratio or a Dr. Boz ratio or a glucose ketone index that should be at least done 3 times a week if you're trying to repair an immune system.
Please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.